Okay. Hi, everyone. I'm going to be talking about my fieldwork case study. I was in a school-based setting, specifically in the San Bruno Public School District in California. So the client I decided to focus on is a 5-year-old Asian American boy. He is the oldest son in his family, and he has a younger sister. He was referred to OT by the teacher and school psychologist. Initially, the school teacher noticed that he was toe walking and had a kind of wonky grasp. And so that's when he initially got flagged. The services were conducted in the public school system, and I was able to observe him across various different settings, like in the classroom, during lunch, the playground, circle time, etc. So, and just for a reference, he's in kindergarten. So, the primary diagnosis identified by the school psychologist was autism spectrum disorder. One thing that I learned in the school is that there can be two different diagnoses. So, the school psychologist can have a diagnosis, and then there's also a medical diagnosis. So, just something that was interesting. And then, other than the ASD, there was no other concerns from the IEP team or the family. So this is a lot of words on the slide, but essentially, my client was referred to OT due to concerns affecting his classroom participation. He's very curious about how different things work. So, like how keys work in the door. He always would look under the desk at the wheels. So a lot of like mechanical things interested him. He really enjoys gross motor activities and has a strong visual memory with the mechanical toys. Some of the main challenges and one of the main reasons why he was seeing OT was fine motor concerns. He had really poor core strength, postural control, etc. He actually skipped the crawling phase, so just a lot of generalized weakness. Um, and yeah, he responds really well to movement-based activities and a structured routine. And his family was really supportive. So, in terms of assessments in the school, I primarily used these three assessments. So, the BERI, that really looks at visual motor integration. The BOT2 looks at fine motor precision through specific activities like drawing, cutting, connecting dots. Scoodles is a new one that I don't think we really talked about too much in school, but it's more informal and it just looks at handwriting readiness. There's some coloring in there as well, and then just general observation. And so essentially, the findings were that this student really has some fine motor deficits, very poor motor coordination. He has some sensory seeking behaviors, limited attention, doesn't really like to interact with other peers, and transitions were also really hard for him. So these are some examples of the goals that I wrote with the OT that I was working with. And it seems like every school district kind of has different guidelines in how they want the goals written. But essentially, the first goal is a lot about posturing and postural control during tabletop activities. And then the second goal is more geared towards like the grasp and completing pre-writing strokes. So if I didn't already mention, this student oftentimes wrote with his arm elevated like this. So in OT, we're really trying to like lower his arm and just kind of work on that grasp a little bit more. And I use the PEOP model to really guide my interventions and my goals. Yeah. So for the main interventions in the school, we do work a lot on fine motor. So hand and finger control for writing and arts and crafts. We did a lot of core strengthening. So sitting on a wobbly cushion, using the, oh gosh, what are those called? They're the little scooters that you have on the floor. So the student was kind of reaching, working on posturing, social participation. We didn't do too much of this just because when we first started seeing this student, it was earlier on into the school year. So, yeah, sensory processing and then emotional regulation. So we'll talk a little bit more about that in the next couple slides. but we used the zones of regulation and also some inside out characters because the student really resonated with that movie. So for the intervention strategies, we did gross motor warm-ups. They're the scooter boards. Those are really fun. We use those a lot. Did some obstacle courses, balloons, just to really work on that gross motor. And then we use therapy a lot in this school system. So hiding erasers in the therapy, having the student kind of pull it apart and separate the erasers. And in terms of compensatory approaches, wobbly cushions and Velcro were very, very helpful for this student. We also trialed using a kickband. I think it was more of a distraction for him, but again, a lot of OT is like trying things, talking to the teacher, seeing how it works, etc. Okay, some more things. So for social emotional support, as I kind of said, we did the zones of regulation curriculum, and we also had these inside out visuals. The student really loved this movie. So I don't remember what the name of the YouTube video was, but there's a good video that kind of ties with the zones of regulation, but also the inside out characters, and it was really cute, and the student really enjoyed that, and it was very meaningful to him. And then another thing that we utilized was Matman, and this was a lot of fun. I believe an OT created this concept, but it really helps with body awareness as well as build some pre-writing skills. This is the evidence that has kind of supported my interventions. So as you can see, the Handwriting Without Tears and Matman was actually created by an OT, and so it's a really good program to use in the school system. So if those of you are interested in school, I definitely would look into this. And then I also pulled some of my interventions just from this AOTA scoping review. Okay, so at the time of fieldwork, the student just started receiving OT services. So this was right after Christmas break. And so I didn't really get to see too much. Like I only saw 12 weeks of OT services. But within those 12 weeks, the OT and I already observed increase in participation during fine motor tasks. The teacher was reporting some improved postural stability. He wasn't using his arm like this anymore. There was some interest with the zones of regulation activities, and then the patient was able, or the patient, sorry, I'm in the hospital right now, so I'm used to saying patient versus client. The student was able to kind of make his own selection and see what different sensory strategies worked out well for him. So he really liked the wobbly cushion and the Velcro. Okay, so discharge and follow-up, as I said, services were still ongoing by the time I finished my field work, but I do keep in touch with the OT in the school, and she said that he's doing really well. And so in the school, there'll be an IEP next year, and then just continue to collaborate with the classroom teacher as the student progresses through schooling. So that is it. Thank you so much for listening.